You're listening to Innovation for Alpha, where we explore everything at the intersection of healthcare innovation and finance. Through our discussions and interviews, we keep you informed and educated about healthcare innovations, next-level venture investing, and everything involving the combination of the two.
Hi, everybody. This is Tobin Arthur with the Innovation for Alpha podcast. And today we have a fun conversation. One of my favorite things is when we find a team working on something who have different backgrounds. And so we have both of the entrepreneurs, the clinician in this particular case, the clinician expert, and more of the business side, although, clinical background. So we're going to talk a little bit about their backgrounds, but Dentriage is the company. And we are excited about this because we have a growing network of dentists. And so we love to put new dental innovation in front of everybody. And for those of you who are not from the dental world, you're going to get a sense of why this is a great space, why there's so much opportunity. So, Dr. and Dr. Gandhi, welcome to you both today. Appreciate you being on the program. Why don't we start, Mayul, with you? And why don't you introduce yourself and then Dr. Rupa Gandhi as well.
So hi, everybody. Tobin, thank you for inviting us, and thank you for this opportunity. Glad to join. I'm Mehul Gandhi. I'm a physician, internal medicine by training. I've been in clinical practice for about 15 years in all different settings of primary care world. And we started Dentriage in late 2017 to address the problem of people seeking care for their urgent dental needs and using ERs as their main venue for that care. So American Dental Association publishes white papers from time to time on ER utilization for dental issues. And they say there are about 2 million ER visits a year for dental related issues at the cost of $2.2 billion. And average visit costing $750. Most of these, 80% of these could be taken care of outside of the ER in a dental practice setting. And 70% are easily just dental pain. So it's not even a trauma or some other situation requiring a procedure. So we have a massive mismatch of utilization for this dental care issues. And we want to fix that by providing a tele-dentistry solution where people can access a dentist 24/7 via video call and have their urgent dental needs answered instead of going to the ER and going through that whole process. One of the main issues that we also want to address is access to dental care. So not only do you want to take care of the urgent dental issue that people are having, but often they need to follow up with the dentist and they don't have a primary dentist, and they kind of just, they fall through the gaps and then wait until the next time they have a dental, issue arise and go right back to the ER. So we want to make sure that once we take care of the urgent issue, we can link them with community dentists that has availability that they can book an appointment with. So we want to close that care loop as well. So that's what we're trying to address. I'm going to introduce my better half and our Chief Dental Officer, Dr. Rupa Gandhi. She's a practicing dentist, has been practicing for around 20 years in multiple different settings. And she can talk a little bit more about, her experience and why this is an important issue to address.
Yep. Thank you, Mehul, and thank you, Tobin, again for having us on this podcast. This is a really wonderful opportunity, and I can really talk about this from just my daily experience, I guess. I've been practicing dentistry, as Mehul said, for at least the past 20 years now, and during that time, I look back and I can think of countless stories of patients who have shown up to the ED because I've worked in hospital settings and community settings where I've been on call pretty much 1 week of every month for the past 20 years. And during that time, I've seen patients with dental infections, traumas, and I've kind of realized that, these patients really maybe didn't have to be in the ED or are in the ED because they don't have a regular dentist to go to. I had an example of a patient just from, a couple of weeks ago who had come into the emergency room in one of the North EDs. And basically the ED physician thought that the patient had an abscess when in fact he had a dental trauma. And he was told to go back at home and see a dentist on a Monday or Tuesday when he could be seen. And I was really saddened by this because when we saw the patient, we knew it was a dental trauma. And I so wish that the patient had a consultation with a dentist at the time that he was seen, rather than waiting 24 to 48 hours later to find someone to kind of figure out what was going on, because that would have made the difference between him getting a root canal, keeping his tooth, or not. So, this is just a really basic example. I have an example, of patients who've had abscesses that, that they're waiting in the emergency room for several hours because the ED room is so busy. And these are young patients with, with parents that have taken, they're coming to the ED at the end of the day because they're working all through the day. They're sitting there through the night. And I think to myself, I have a child too. I so wish that they didn't have to wait there for so long. I wish that they would be told that they could go and see a dentist the next morning and have this addressed, rather than waiting so many hours to get that answer. So, these are some of the variations that I've seen of these concerns. And I so wish that we could find that answer. And I think Dentriage is really part of that solution. We're looking to get that access to care for our patients, not just in the emergency room, but really getting them a lifetime of care that's more regular is part of that solution as well. And I think Dentriage offers both of those aspects to addressing the problem. And I'm looking forward to seeing this launch and get that need addressed.
I love it. And you guys are talking about, really taking what's a fairly inefficient part of the market and just taking modern tools that until recent years weren't really available and applying these to create more efficiency in the market. And I'm curious, we'll jump back, Mehul, to you. I want to talk a little bit about how we get from here to there and how are you, from a business perspective, solving this problem. But Rupa, maybe share a little bit. If a patient, and what comes to mind to me, and this may not be the standard, but the patient that you would see in the ER, I'm guessing the primary indicator is pain. They're usually in some kind of pain. They're not generally showing up to the ER because they want something proactively done. So in the case of pain, what typically is the solution? And I think, Mehul, you may have mentioned to me in a previous conversation, correct me if I'm wrong, but most physicians, when you go through medical school training, and the people that would be manning the ER, they only receive, if I remember correctly, a couple days worth of dentistry training. So they have some very rudimentary training. It was probably years ago anyway. First of all, is that true? And then secondly, what's typically being done to triage the pain at the moment, before doing kind of the next steps where there's maybe something procedural that has to happen?
So let me just address the training part of this. So I've spoken with multiple ER docs and my own lived experience in terms of training. So unless you're doing an ER residency, typically a primary care doc or primary care residency program or any other program, you don't get much in terms of oral health training. You get some during medical school, nothing during residency. And the ER docs generally get about 2 weeks of very rudimentary training in terms of dental care, so blocks, extractions, things like that, or just recognizing trauma and what to do. But that's about it.
Yeah, I really like this question because it kind of gets to the heart of what I'm passionate about with our company. So in terms of addressing pain, most of the time what we see is that the pain relief that patients get is maybe with analgesics that are prescribed, but that's again very rudimentary. If the patient has a dental abscess, that's just a palliative patch up sort of, we're going to get you through the next few days. That pain's still going to come back. And it's not good for adults or children to be chronically taking pain medications to address something that should be treated with maybe a root canal, extraction, and then of course, establishing care so that you're not having to lose teeth I think that's the saddest part. We go to the ED and, maybe the care that you're getting is that more emergent care of losing a tooth because you're in significant pain. Or maybe at the minimum, you're going to have some pain medications given to you. You're told to go home and figure out which dentist to go to. And that part also saddens me too, because the resources that our patients have now, or our families and parents have, is that they've got to go online and maybe search for someone, but they don't have a space where they can find that information readily in a curated way that's accessible. And that's a really big gap. And I think that, we're looking at ways to kind of address that gap in a significant and impactful way, so that, these kiddos and adults aren't suffering like that and getting palliative patch-up treatments, that aren't sustainable.
And I'll kind of say a personal story. So third year of med school, I woke up in the middle of the night with severe tooth pain because of an exposed root. And I'm an immigrant from India. I didn't get a lot of dental care when I was growing up. Didn't get a lot of care here because, worked several jobs to put myself through college, that kind of thing. So didn't really have any dental home or a dentist that I saw regularly, and neglected that part of my health. And so I woke up with this severe dental pain, didn't know what to do, ended up in the ER, and exactly my experience. It was a dental pain issue. The doc gave me some oxycodones at the time. This was a while back, so they were a little bit freer in terms of giving opiates, and gave me a piece of paper and say, here are potential dentists. There's a FQHC, Federally Qualified Healthcare Center, that sees people who don't have any dental insurance. I didn't as a med student at the time. Or you can go to a dental hygiene clinic. Those are your options. And, I suffered through the next 2 nights, tried to make appointments, finally found an appointment. And by that time, the pain was better, so I didn't do anything about it. That's my experience. This was several years ago. But even now, if you talk to the ER docs, or if you just look at the experience of a patient who shows up at the ER, they get slotted into triage level 4 or 5 because the ERs are busy taking care of cardiac arrests and stroke alerts and traumas and things like that, right? So they're sitting there waiting for 3-4 hours before they get seen. Once they get seen, it's not much the ER doc can do. And now with all the focus on opiates, they don't give anything other than maybe an NSAID for pain relief and an antibiotic if needed. And then they say, okay, here's a couple of phone calls, phone numbers that you can call next morning or Monday morning, what have you. And then that's it. And it'll be a $750 bill. So that's a very, very frustrating experience for a lot of patients.
So, and I just wanted to chime in really quickly. So sorry. Just about the part about, the frustration with the bill. I think to myself, if the patient had gone to a dentist instead of going to the emergency room, not only would the patient save, the state would save, the country would save. There's so many aspects to this problem that are really solvable with the right approach and technology. The second part about training, yes, the ED physicians, do an amazing job. I can't even imagine how they get through their days doing the amount of work that they do. And it's a lot. They have to deal with so many things. And then having to deal with the dental problem. The ED physician who I found out about from a couple of weeks back, he had misdiagnosed the patient's concern as an abscess based on the information that he had and what he could see. He couldn't figure out that it was a trauma, and if it was a dentist, they would have. And that ED physician did have the training, but it's not enough. And that kind of addresses, this example, my lived experience, and not just that patient's experience, but a number of patients that I've seen, they've gone through that because that training is not adequate, and nor should they have that training. That's in the dentist's, purview. So
well, I think you both have established well this inefficiency in treating or using the ED as essentially the dental office. And we see this in other aspects of ED. across the board, which is the ED's overused for a lot of things. And I think there are other companies addressing ways to triage and manage. So what I like here is that this is not an unknown issue, but you're specifically focusing in on an area that has heretofore not had people addressing it. And you guys have been thinking about this deeply. It's not an insignificant problem to solve. Marketplaces, of which this will be a marketplace, are tricky because you've got to get multiple parties to the table to be efficient, right? You've got to get the emergency rooms, potentially the patient awareness of the app, and then the dentist and the community that ultimately you're going to plug that patient into. So a non-trivial issue. Let's just talk briefly. I don't want to get into too much detail there, but how do you think about organizing those parties? And I'll just caveat that with, there are some companies that take a geographic approach where they say, we're going to get penetration and coverage in a specific market, prove the model out, and then we're going to expand geographically once we figure out the playbook. That's one way to go about it. There are others. How are you guys thinking about this?
So a few things on that. So specifically, we want to partner with ERs and urgent cares to make sure we have a presence in those locations, because we realize that we're not going to compete with Instagram and TikToks for eyeballs and engagement, right? People might need to use the app or the website once a year, twice a year, maybe.
Right.
So we want to meet these patients where they're more prone to go. So they'll still end up, we'd love to create awareness, do SEO and other marketing tools to be able to make sure that the name Dentriage is synonymous with urgent dental care. With that said, we want to have presence in the ERs and urgent cares so that when the person does show up, which more people than not will do, still have the same kind of utilization pattern, that they have the ability there to just go into a room with a tablet and speak to a dentist. And instead of that visit to their ER being 3 to 4 hours and speaking with an ED provider who can do only so much, here you are in and out within an hour, speaking with a dentist, having an appointment already scheduled to see somebody in person. And that's a much better user experience. So that's what we're going to focus on. And specifically, we want to target underserved and Medicaid kind of ERs. So, out of this ER visits, 45% are Medicaid patients. So that's a huge utilization issue for Medicaid. And in rural places where dentists are not available for call, or even just dentists per capita is not that high, this is a huge issue. So we want to approach rural ERs, establish relationships with them, start pilots there, and then prove the use cases based on those interactions, and then move to the larger areas in terms of the Front Range and then other states.
So there is a benefit to the community dentist. You've mentioned this earlier. So this doesn't just benefit the patient. And, Rupa, as you were saying, there's a societal benefit here, which are costs that are being spent that don't otherwise need to be spent, Medicare, Medicaid, et cetera. But talked about a little bit about the benefit to dentists in the area who become part of this program and how they can become a feeder.
Okay. So the few things, one is obviously a lot of dentists, unless it's a mature and established practice, or if they bought a practice that was already established, are always looking for patients. Patient acquisition costs can run from $300 to $500 per patient. And they're advertising with traditional sort of marketing methodologies, newspaper ads, flyers in the mail, SEO kind of stuff. And it's sort of a shotgun approach, right? It's kind of scattershot in anybody who sees something, and there's a lot of competition. So we flip this and say, here's a motivated patient who's looking for an appointment. We're going to make it easy for them. As long as you publish your appointment schedule with us, we're going to make it easy for them to schedule that appointment. So all you have to do is confirm and make sure that patient comes in. And that's a very high value referral source for that dental practice at much smaller cost point than they would otherwise in terms of the patient acquisition cost. So that's number one. And eventually, you know, a lot of dentists, especially if they're solo practices or small group practices, are struggling with being able to provide call coverage for their patients. And they have to get into these call groups, and it's, you know, you don't know the patients, and there's a lot of different, and Rupa can speak about that a little bit more detail, but they're struggling to provide calls for their own patients. And we can kind of offer them as a part of this service and say, hey, if you're not available, we can have a dentist take a call for your patient, and you don't get bothered on a Memorial Day weekend 10 times overnight or something, right? So that's another benefit for community dentists.
Yeah, so in terms of the call coverage, I can definitely speak to that because I have dentist colleagues who who talk about this all the time, and who mention that, well, yeah, I've got to get into this call group, and then here I am on call. How am I going to figure out, when I'm going to see my patient? What if I, want to make other plans? There's a lot of barriers, and being on call for the past 20 years, a week of every month of the past 20 years, I can tell you it's cumbersome. And it's tough when they're in these call groups and you're having to take that call so many times. So I think that this also alleviates a little of that load.
Sure.
If we're talking about provider wellness standpoint and having some of that balance as well, especially on those long weekends. And my experience also is that, those dentists might then say, oh, okay, you've got this issue. Well, I'm not taking call that weekend, but you can go to the ED.
Right.
On that weekend. And that's where the patient then ends up in the ED. And that's really tough on them. It's not a great provider experience. It's not a great patient experience. And I've seen those patients come through the ED, into our clinic. So that's always difficult to see and to know that both ends of that are not working well.
So it's another resource, it sounds like, for the dentist for sure in the community. Let's jump forward a little bit to the pragmatics. You guys are raising a little bit of capital to help staff up the business and build out the MVP, $350,000. And let's talk a little bit about the milestones that you intend to achieve with that new capital.
So thank you for bringing that up. We are looking at raising about $350,000 pre-seed, sort of friends and family round. We want to build up a DevOps team. We have a team identified overseas in India and in Turkey that they can do all the development work. We need a full-time CTO stateside to kind of make sure that we're able to manage all of the development, database administration, and any other technology related issues that we'll need to sort through. And that is to kind of get the MVP up and rolling. MVP will consist of triage algorithms where a patient can answer a series of questions, and based on what they answer, they get recommendations about what to do next. It will have a search function with geolocation, and it will have the ability for dental practices to publish their appointment schedules or availability, and then for a patient to book those appointments. So that's just the MVP. And then as soon as we have that, we would like to pilot that and then follow that up closely with the video consult capability with live dentist.
That makes sense. And you guys recently were admitted into a new program, which is validating. Talk a little bit about the Innosphere Colorado Life Science program.
Yes, thrilled to be a part of that. This is an inaugural program. It's a life sciences incubator program, which is a partnership between Colorado Bioscience Association and Innosphere Ventures. And we were one of the companies selected to take a part in it. It's just a wealth of resource. We've had a few sessions in terms of education and things like that. There's lots of connections being made, and we get to work with one-on-one with a client manager who's very well experienced in entrepreneurship and health tech. So this is a great opportunity to be a part of a program and meet other like-minded entrepreneurs, and then they're really kind of giving us the boost that we need to launch and to grow. So just thrilled beyond words to be a part of that.
That's great. And this is a great story, and we're going to follow you guys closely. We love it that it's a Colorado-based company, so we always have a little special something in our hearts for local companies. But as you guys hit milestones and are learning, we'd love to hear about that and share that with the community. We'll create information in the show notes for people to contact you if they'd like to be involved in some capacity, whether that's as a potential investor, and maybe even as a beta user once your MVP is ready. So I really appreciate. It's fun having a husband-wife team working on something like this, and especially when you're both doctors. What a great background. It's very powerful. So thank you both for spending time today and sharing just a little bit about Dentriage. We're excited for you.
Thank you, Tobin. I had just one quick comment about, you mentioned, if people want to get in touch, love to hear from folks, especially if there's any dentists in the audience. We'd love to hear from you, learn about your experience and your thoughts about this platform that we're putting together. So please feel free to reach out. We'll put all the information in the show notes.
Absolutely. Well, thank you both. Great to meet you.
Thank you so much, Tobin. Really appreciate your time.
Thanks, Tobin.
Thank you.
See you again soon for the next episode of Innovation for Alpha. Make sure to go to Innovation for Alpha for access to prior episode links, show notes, and other valuable resources. This show is for entertainment purposes only. Before making any investment decisions, please consult with a professional. This show is copyrighted by Angel Indie Media, and written permission must be granted before syndication or rebroadcasting.